Chapter 1, what you need to know to cure your anxiety disorders. The 3 most important things you need to know. 1, all phobias and obsessions, including yours, are curable. 15,000 successful Phobies class graduates cannot be wrong. If you do the work, you will cure. You want to know something else? They are easy to cure. 2, you were born to have an anxiety disorder. There is a huge genetic contribution. It runs in families. It is not lack of courage, willpower, or moral fortitude, and it is not the result of poor parenting. You were born with an anxious predisposition or a biological sensitivity that led to your anxiety disorders. 3, you are not trained. I don't look at anxiety disorders as terrible psychiatric problems. Rather, no one has trained you in how to effectively manage your anxiety. Almost daily, I receive phone calls from people who have been in therapy for years. 5 minutes later, I realize they have virtually no insight or useful knowledge about their condition and do not know what they have to do to cure. By the time you have completed Chapter 3, you will be trained. Scope. Anxiety and fear are epidemic in our society. 9 out of 10 people have mild restrictive fears. 2 out of 3 people are uncomfortable speaking publicly. Prior to September 11th, 2001, 1/3 of all people were uncomfortable flying, and now 2/3 are uncomfortable. 25 million people won't fly at all. Fear has crippled the American airline industry. 1 in 10 of us, myself included, have severe restrictive phobias, and 1 in 25 have obsessive compulsive disorders, or OCD. The painful part of anxiety disorders is that we will waste $10,000 on unnecessary medical visits and tests. I spent 3 times that much. We will see 6 to 10 practitioners and go 6 to 12 years without being appropriately treated. 70% of us will never be diagnosed. I went 31 years before I was diagnosed correctly. During that time, the most bothersome statement I read was, "If you face the fear, it will disappear." Well, for 31 years, I faced my demons every morning. Upon awakening, I would review the day's events to see where I might be trapped, have a panic attack, and be found out. For 31 years, I was forced to endure the anxiety caused by public presentations, shows, and restaurants. Hundreds of times, I found myself at high levels of anxiety, hanging on by the skin of my teeth, while I repeatedly faced my fear. And it got worse. Why? Because there was a word missing from that face the fear phrase. That word was correctly. Face your fear correctly, and it will truly disappear. I was facing it incorrectly all those years. I did the exact opposite of what I needed to do to cure. Can you juggle? For 31 years, I did everything wrong. I always asked my classes, "Can you juggle 3 balls or more?" I can, and proceed to demonstrate my skill. But in a class of 50, it's rare for more than 1 or 2 people to raise their hands. Then I ask, "How come you others can't juggle? Is it because you are stupid and uncoordinated? Is it because you have never been trained?" With prompting, they agree that they have not been trained. The reason you have had your phobias or obsessions for years, the reason you are reading this book, is that no one trained you in how to effectively manage your anxiety. The reason I had phobic symptoms for 31 years was that I was untrained. Well, I'll teach you how to juggle. Throw 1 ball a little higher than your head and catch it in the other hand. Then start with 1 ball in each hand. When the ball reaches its apex, throw the second ball inside of the first. Finally, with 2 balls in one hand and 1 in the other, complete the juggling process by throwing each ball inside the apex of the other. Practice 2 million times to get an automatic muscle program called an engram, and you are a juggler. This book will take you on a specific path that will teach you to cure your anxiety disorder. There's nothing vague about the process. You don't even have to know how your problem began. You will never be forced to do anything you are not ready to do. Phobies is not in competition with your present therapy, but most people can cure their phobia or obsession without a therapist. The American Psychiatric Association, the APA, and the Anxiety Disorders Association of America, ADAA, have recommended that the preferred therapeutic regimen is psychoeducational, cognitive behavioral, and experiential desensitization. How's that for a mouthful? If you have not been treated with such a program, you have not been treated appropriately. By the time you finish this book, you will be trained. You will know precisely what you need to know and how to use it correctly in order to cure your specific anxiety disorder. The 3 myths. All phobic and obsessive patients share 3 devastating myths. 1, I'm the only one who has this. You and 46 million Americans will suffer an anxiety disorder in their lifetime. Virtually 1 in 4 adults and 13% of children. The problem with such a myth is that it isolates you. I don't dare discuss it with anyone because it's so rare they probably wouldn't understand and would think poorly of me. I never shared my disorder with anyone for fear that they would know I was blemished and defective. 2, I am crazy or I will go crazy. As a matter of fact, phobics don't go crazy, but we worry that we will. Indeed, one of the most annoying aspects of these disorders is that we are amazingly sane. This disease doesn't make any sense. I should be able to solve this rationally and logically, but I can't. I've read innumerable books and visited the internet ad infinitum, and I'm no closer to a cure. I used to envy 4-year-olds who were sitting on an inside seat of the aisle. I always thought it would be nice to get a brain enema, flush the phobic thoughts out of my brain, and I could start over with a clean slate. You will find out later that you can't stop thinking of things, and that approach is unproductive. The problem with myth number 2 is that it scares us and adds to our daily stress level. So far, I'm isolated and frightened. 3, my case is so severe, so unique, so chronic, that I am incurable. The result of this myth is depression, a feeling of helplessness and despair, and utter lack of hope. 60% of patients with anxiety disorders get depressed. After 31 years of symptoms, multiple therapists, and many medication trials, my phobia persisted. It did not take a rocket scientist to come to a very depressing conclusion. I was going to be like that for the rest of my life. Can you imagine my surprise when I finally received the appropriate treatment and in 4 weeks, just 8 hours of instruction, I was 95% better? I knew then the fallacy of the 3rd myth. Indeed, all phobias and obsessions, irrespective of their duration, are curable. The anxiety spectrum. As I began to treat large numbers of patients, I realized that anxiety is a spectrum and a continuum. The average phobic has 12 to 15 separate issues. Regardless of their disorder, the dynamics of the disease and the people who got it were the same. Incredibly, that meant that no matter the prevailing diagnosis, the phobes treatment was applicable. In essence, then, every word in this book applies to your anxiety disorders. Every word. Dr. Fear. My nickname, my license plates, and the tie I wear to the first class all say Dr. Fear. In phobies, the word fear stands for F for false, E for exaggerations, A for appearing, and R for real. So fear is false exaggerations appearing real. Later we find, as we learn some tools, that Dr., DR, stands for dispute and reframe. It is extremely important to note that all fears are exaggerations of normal concerns. We are not crazy. This is a dangerous world. Phobics always want to be reassured that things are safe. I tell them, if you want to be safe, don't be born. That's usually met with an audible groan. Safety is an illusion. There can never be a guarantee of safety. Even our perceptions about the topic are distorted. We view flying as dangerous. Well, I'm going to cure your flying phobia right now. Do you know how many people were killed on American commercial airlines in 1998 and 2002? None. But during those same 2 years, 100,000 people were killed in highway accidents. So don't drive to the airport, stay home. Unfortunately, in those 2 years, 16,000 people died in home accidents. So best to get out of the house. Take a walk. Alas, 12,000